Let's watch a cavity filling procedure at the dentist. The goal of this procedure in particular for this patient is to, of course, remove the cavity, which happens to be in between two teeth, and also contour the filling to make sure it's flossable so the patient will not get another cavity in this area. Hi, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today, we're going to watch a cavity filling procedure at the dentist. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to discover all of the essential components for an effective oral hygiene routine to help maintain a healthy smile by preventing cavities. And having said that, for today's video, let's walk through a cavity filling appointment. First, the dentist or the dental assistant may take your blood pressure prior to numbing you up. Next, they may apply a topical anesthetic on your tissue so you won't feel the pinch from the needle. Then you may receive local anesthetic. Once you're numb, the next step is to use a drill or an air abrasion instrument or a laser to remove the decayed area. In this case, the dentist is using a drill to remove the tooth decay, aka the cavity, out of the tooth, starting with a high-speed handpiece. This specific high-speed handpiece drill sprays out water, so there will also be a suction or saliva ejector in the patient's mouth during the drilling to suction up the water. Now, this green liquid that they just placed on the tooth is a cavity detector liquid, or also called a caries finder. It can help see exactly where any residual cavity is, but it sometimes gets on the gums too. So if you're like, what happened to the gums? It will easily rinse away later. Next, the dentist will use a slow speed handpiece, sometimes called Mr. Bumpy, to remove more decay. This drill does not spray out water, but it's a little bit bumpy. You'll feel the vibration, even though you're still numb. You'll still feel pressure. Oftentimes, the dentist may say something like, hey, you might feel this, it's kind of bumpy, but it does not hurt because you're numb. Okay, and then they're all done with the prep. So next is the filling portion. And for this specific cavity, it's between the two teeth. So before they fill it, they need to place a band around the tooth and then a wedge so that the filling material does not pour over onto the other tooth next to it. It's separating the two teeth away from each other. Then they may use a clamp on top to hold it all on. They may use an instrument to burnish the band against the adjacent tooth, and now they are ready for the filling process. The dentist will first place etch on the tooth. Etch is an acid gel, usually blue, and it's used to roughen up the surface of the enamel. Then the etch will be rinsed and suctioned and dried to prepare for the next step. Now you'll notice that they have actually turned off the bright light because the tooth-colored fillings are hardened by the light. This type of filling, the composite resin filling, is applied in layers, and right now you're watching the first step of the bonding agent where they brush it on to etch and prime the tooth. The next step is the adhesive, which is light cured. After brushing it on, they will use the special blue light to harden it. Now the tooth is one step closer to being ready for the tooth colored filling. Here they are placing the filling material on the tooth, and the different instruments are used to pack it and make it look more like a tooth. Dentists will spend some time on making it look like a tooth. They want to mold the composite filling material that they just placed in there so it can match the shape of the surrounding tooth. Once it's ready and the dentist is happy with the shape, again, this is usually the part that takes a little bit of time. After repeating this step a few times, adding filling material, shaping it with the instruments, adding filling material, shaping it with the instruments, then they will light cure it to harden it. The dental assistant may leave the saliva ejector in the corner of your mouth throughout the process, or they may put it in and out throughout the procedure. But either way, you'll mostly hear lots of suction noises during the appointment. Once they are done with the filling material, they'll take off all of the wedges, bands, and clamps around your tooth. And with a high-speed drill again, they may remove any sharp edges. They may floss it to make sure the contact between the two teeth is good. And lastly, they may check the bite with the biting paper, also called articulating paper. Sometimes it's difficult for the patient to tell for themselves if the filling is too high or not because you're numb, right? So this paper helps the dentist see if your bite is looking too high or not. If it is too high, they will trim off the excess filling material with the high-speed drill. They may check the contact again with the floss, and then they will polish it so it's nice and smooth. And there's your final restoration. And that's it. Filling appointments are not too bad. Once you're numb, you don't feel a thing. But still, even though filling appointments are easy, if you can avoid needing a filling by avoiding getting cavities, that's always best. So be sure to keep up with your daily routine of brushing and flossing at home. And if you're interested in creating the perfect routine at home, make sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide. I hope you enjoyed this video. Please like, subscribe, and turn on your notifications if you did. And if you want even more dental tips, you can hang out with me on Instagram at Teeth Talk Girl. Peace, love, and teeth.